And then we have psychoanalysis, where they are going to analyze the patient's personality development right from his childhood. And we also have codes for hypnosis, hypnotherapy. The patient would be subject to sleep, and from that they will start arousing, at a subconscious level, the psychiatrist is going to elicit the conditions that trigger the patient's current development of his personality disturbances or behavioral problems. Next, we have something called shock therapy. We say that as a electro-convulsive therapy, right? Patients who don't cooperate, as a kind of punishment, they give this ECT. Next is a sodium amytal interview. So what happened? This is a kind of treatment that is given for criminals. If police who is investigating the case wants to know the details of particular incident or any murder, at such times they're just going to give this sodium amytal, so that patient would be a kind of they go to a state of a subconscious and they try to see whether the patient is revealing the truth or not. You can expect a question from therapy and all that, and the procedures or the services under this section are pretty straightforward. You can easily select the codes from this chapter. Next thing that we can see here is a biofeedback. So imagine a child, a 10-year-old child who's having a neurosis or a bedwetting. Parents are finding it difficult, to wake the child up as she's doing this bedwetting for years. Now here there can be one technique. What can happen is say during the sleep, you can set an alarm at a specified hour of the day so that you can wake the kid and she passes urine and then comes back to sleep. Okay, so when you repeat this for a few days, what happens is, now because the alarm sets in and the child wakes up and she does a regular work. But what happens after some days, even without the alarm, the child wakes up, she passes urine and then comes back to bed. So this is a kind of a training that can be given to one's own self, and this is called as biofeedback. So it gives the awareness, about the person's physiological processes that takes place within the body. So we have codes for biofeedback by any modality.